Welcome to the Eastman Dental Podcast, where we hope to inspire, motivate, and provide education from our guests' experience.
Today we're joined by Nikki Rostami and Max Nicholls, who have both taken time out of their busy schedules to talk to us about their experience transitioning from dental core training back into practice.
I love how busy it is and how you're like on all the time and you see a wide variety of people day in, day out. And I love making that social connection with every single one of them and, you know, getting that relationship with every single one, seeing them come back, finishing treatment plans. It's a very different to hospital. You got a lot more independence. Things get done a lot quicker, which is good.
I then thought, oh, you know what, that I don't really want that for myself. I don't think I want to work in a small practice, you know, potentially 6 days a week for the rest of my life.
With your host, Josh Hudson.
And I think a lot of trainees are probably going to be at a crossroads where they're thinking about whether to pursue more dental core training or a more hospital-based pathway, or whether to go back into practice. And I think potentially there's a bit of anxiety about that transition. So I'm really excited to hear about both of your experiences and hear any advice that you might have for trainees in that same situation. So I think first of all, if you just tell us a little bit about yourself, Max, what's your history? What have you done? What jobs have you done? How have you got to the point that you're at now?
So I grew up in Kent in the southeast of England and went straight to dental school from school as a school leaver. Studied at King's and then enjoyed being in London, and so stayed for my foundation training and did that in southeast London in a practice in Camberwell. And then after foundation training, I spent a year at the Eastman doing a restorative dental core trainee post, and have, as you were discussing, have subsequently now transitioned, and I work part-time back in practice in the same one where I did my foundation training in Camberwell. And then I spend 2 days a week still at the Eastman Dental Hospital under the Education Centre as a tutor dentist for the School of Hygiene and Therapy.
Great. So it's a nice mix. Nikki, how have you ended up at the position that you're at now?
Yeah, so I lived in London and then went straight to dental school as well, went to Cardiff, but then after 5 years thought I should come back to London. So I got the North London Deanery for my DFD and then went in to do DCT1 at Guy's Hospital. It was a mixed post, 6 months restorative and 6 months oral surgery. And then after that, I'm now doing practice for 3 days a week. At the moment I'm in New Cross, and I do for the other 2 days I'm a restorative staff grade at Guy's Hospital.
Great. So I think I'm right in saying that you guys were that cohort of DFTs that were kind of slap bang in the middle of COVID. And I know when we were talking to the current DCTs about the DCT pathway, they were talking to us about their experiences within that. How was it for you? How did you feel that COVID interruption, should we say, to your FD year affected you?
Well, I guess initially, like everyone, everything was a bit chaotic. And we spent a lot of time doing online study days and working and working from home. And then when we went back into practice, we were just doing telephone triage and issuing remote antibiotic prescriptions where necessary, and spent several months doing that prior to coming in a sort of slightly bizarre post-COVID setup, which was still being figured out by the powers that be.
It's still now being figured out.
And it's still now being figured out. And so, having to sort of get your head around the whole AGP, non-AGP scenario. And I guess most of us experienced some sort of redeployment. And so I was initially posted to care homes to do COVID testing on residents and staff. And then I went on the crash course for the Nightingale Hospital. Although I arrived there on the day that they announced the Nightingale Hospital was closing. And so I had my crash course and wasn't ever put into action. And then I guess outside of that my dad is a pharmacist, and he had his own pharmacy at the time, and they were just completely inundated. And so on weekends and bank holidays and things, he had to be open all hours. And so I was back at home helping him out, and so got to experience lots of different aspects of healthcare during that time, which obviously wouldn't have done had COVID not hit.
Yeah,
so
loads of different
an
things.
interesting time, I guess.
Yeah, Nikki, how was it for you?
For me, it actually had a very unfortunate time because within FD, I had to actually change practice, and I had just changed practice and had just started within the new practice. And I think it was just under a month when COVID hit and we had to stop everything. So for me, it was really, really unfortunate. I was really looking forward to, getting settled in a new practice. So already I was at a disadvantage compared to my other colleagues because, with the disruption, I had seen less patients. And again, as Max said, we were seeing patients over the phone. That was quite an interesting experience because I had to send my YouTube videos on how to put their own temporary fillings in, and I was put on speaker and you could hear them grumbling on the other end, not happy about the situation. So it was an interesting time. So yeah, it was different. I was also redeployed, kind of different to Max. I was mainly working with the police and the fire station, helping out the ambulance services just within the community. So yeah, it was actually really, really nice working with different members of the community and getting out the healthcare world a little bit and working with the police. It was a different take, really. It was nice.
Yeah, sounds interesting. So I think you both had different experiences. I think my question was going to be, did that impact your training? And obviously, I guess it did. But it seems like you gained some additional skills from these other things that you ended up doing. So I don't know, how did it impact your training? I think that end of FD year is where everybody kind of feels like they start building up and getting more confident, and you lost that bit. Do you think it really affected your clinical skills and your confidence, or did the other skills that you gained kind of counteract that a little bit, or how do you feel it affected your training?
Personally, I felt like I was more confident in other ways, in my personal skills, my communication skills, being thrown into something that we didn't know what to do and adapting to the new environment. It was almost more scary than the first day of FD because at least I knew, how to do fillings and things. But in this new position, everything was unknown and it was changing day by day. So becoming a bit more adaptable, and my communication skills really developed. But at the end of it, I really went into DCT knowing that, my other colleagues had done potentially more clinical work, and personally, I felt more disadvantaged clinically. And I think that did take a hit in my confidence clinically, and it put me at a different position to other people. It made me want to do more in DCT and, catch up with the gap. But that's my personal experience.
Yeah, I think I was quite fortunate. The practice that I was in was a really long-standing FD practice, and so I really hit the ground running and had worked up to a good work level by the point that the pandemic hit. And so I think sort of from about Christmas time during FD year, from that point on. So I guess pre-COVID, we had about 3 months. I'd say that during those 3 months, I found that I was really working at a good rate. I wasn't really calling my trainer in too much for assistance. And I felt that my confidence in my clinical skills was really building. And so it was definitely frustrating when the practice has to close its doors and we didn't do anything clinically for so many months. But I think I could still reassure myself that I had reached a good level of confidence in my clinical skills, and we still had 5 years of dental school behind us and all the clinical work that we'd done there. And so I think, we just sort of, everyone was caught up in this exceptional time, and all of us suffered in some way. And so I think I just felt grateful really that we were still kind of under that protective umbrella of being a trainee. We still had a guaranteed salary. It wasn't like associates who were in a really sort of stressful situation life-wise because they all of a sudden their income was slashed. And so I think that in terms of the anxiety that the dental profession was feeling at that time, as a trainee, I think sort of it put into perspective, things weren't too bad for us.
Yeah. Okay. So I think it's quite different experiences by the sound of things in terms of how you felt that affected you. And then obviously you both went on to do DCT jobs. So just briefly, what DCT jobs did you end up doing? Max, you mentioned DCT and restorative at the Eastman.
Yeah. So.
And Nikki, you were at Guy's, is that right?
Yeah.
So how do you think, did that COVID experience influence your decision to undertake DCT? Was that something that you always wanted to do? Did you feel like you needed that little extra support for that first year after that disrupted FD year? Or how did a DCT come into your kind of plan at that point?
I always knew I wanted to do DCT just because I wanted to see how it was to be in the hospital.
Yeah.
Just you won't ever get that experience again. So I thought, why not?
And keep options open, right?
Yeah, exactly. And you don't it was the thing that really appealed to me at the time was that it was quite structured and I didn't have to decide there and then what to do. And I picked oral surgery and restorative because it kind of kept my options open, I knew that I enjoyed restorative, so that was that. And I knew that I needed more work on my oral surgery skills. So one was one I enjoyed and the other one was, to make myself a better dentist. So that's why I chose that job. And it was 6 months of both, so it was mixed. Personally, the thing, as Max said, it was really good because I knew I was going to another training post. And when we went in, the first thing our consultants said that they knew that we didn't have much experience because of COVID, because of our redeployment. So they essentially, for me personally, I think they treated us differently to the other cohort. So within the first 3 to 6 months, we were a lot more, supervised. Help was more available if we needed it, less thrown into the deep end, really. So I think that was quite helpful.
Yeah.
And I really enjoyed it. Really, really enjoyed my time. Would recommend anyone to go to Guy's. It's a great place.
Perfect. And then Max, what did you feel the same? Were you always planning on doing DCT?
Similar to Nikki, I did want to get a feel for what it was like working in the hospital, and again keep my options open. And so I sent off my application for DCT, but wasn't really sure what area I wanted to be working in. I was enjoying my time in practice, and restorative, encompasses pretty much everything that you do in practice.
Yeah, very practice applicable. Both, I guess, are really practice applicable
and
jobs.
So I wanted to, I didn't want to go in, I didn't want to go step too far away from the skills that I'd been honing through dental school and through practice. And so I wanted to do a restorative post ideally, but the national recruitment process is quite a strange one, and you don't always get what you wanted to do. And it's very competitive getting into a DCT post. So I didn't really have my heart completely set on it, but I was really glad to get a restorative post. And then I think, I'd say that I was very fortunate going into the restorative post, having had a year of limited clinical activity, that the post here at the Eastman is quite unique in that they have a relationship with the UCL postgraduate dental school, and the DCTs who are on restorative posts get to join the postgraduate students in PROS for their introductory course, which has a lot of phantom head and laboratory work within it. And so doing those phantom head activities, crown preparations, and bridge preparations, that sort of thing, and refining those skills in a simulated setting was really, really helpful in getting the hand skills back, just getting used to doing practical work again. And so I did feel grateful for that prior to doing those treatments on patients, rather than just being thrown straight in. I think that had that been the case, I would have been a little bit anxious about it, having had a few months of away from doing clinical work. And similarly really enjoyed my year, had no regrets at all. I learnt a great deal and really built on my undergraduate learning, and plenty of things were sort of demystified, from occlusion to ceramics and different preparations and materials and dentures. I feel that the skills that I learned were definitely definitely applicable to practice and whatever I then wanted to go on and do.
So that sounds like there was a really beneficial element of the DCT program to your undergraduate and your FD year training. And then moving forward, obviously you've both now decided to step back out of, well, to a degree, step back out of hospital into practice. So the first thing really is, how have you found that transition? Have you found it easy to go back from hospital back into practice? Has it been, were you worried about it in the first place? Has it been easier, harder? How's that transition been?
For me, at the beginning, it was quite daunting and I didn't know what to expect just because I didn't actually have a proper stint at FD, you know. Within the first practice, I had to swap to the second practice because there just wasn't a lot of patients there. So I was behind on the UDA values. So even then, you know, even if it was 6 months there, I didn't really have the patient load. So one of the things I was really afraid of, I guess, at the beginning was seeing that amount of patients to begin with and how I would manage to do that.
How you'd cope with the UDA pressures,
exactly.
which I guess is what everybody's concern is going back into practice from hospital where things are slower.
Definitely, yeah. And like phasing treatment, different stuff that you don't quite learn in DCT or practice in DCT. And within DCT, like within my restorative, we saw maximum 3 patients in an afternoon.
And then you switched to how many patients?
Around 15, 17 now. So yeah.
But how was it? Was it okay? Well, you obviously made it through.
So yeah, made it through. At the beginning, it was just really tiring. I think that's with starting any new job. You know, you gotta acclimatize to the place. You gotta get to know the team. It was a lot of new things to learn to begin with. But I soon managed to, you know, get the hang of these things. You build up speed quicker than you think you do, you know. And I just say, take your time. But at the end, it was fine. Looking back on it, it was okay. But before I started, I was a bit terrified, not going to lie.
How was it for you? Was it?
Well, I think I should have been feeling a lot more like Nikki was, but but probably quite recklessly, I thought it was all going to be absolutely fine. I think I had the security of going into my former foundation practice, and so it was an environment with which I was familiar. I knew all of the nurses, I knew the other dentists, and got on really well with them. And so I was looking forward to going back, but I think I hadn't quite sort of considered the fact that I was going back as an associate and not as a foundation dentist like I've been before. And so there are obviously different demands of an associate dentist. You know, you need to see more patients, and you know, work more efficiently. And so I did struggle initially. I think similar to Nikki, with hindsight, looking back, I was absolutely fine, but I'd just become accustomed to having longer appointments and being able to you know, take my time and really refine things. And then I, you know, was just thrown straight back into sort of 20-30 minute checkups and having to condense everything down into that amount of time, and just all the talking was really tough. I actually ended up, it was around the time when there were loads of colds going around because we were all starting mixing again with lockdowns and everything ending. And so within like my first week, I went down with a horrific cold, which was probably thanks to being so exhausted and doing all this talking. But subsequently, you know, with time, things became much easier, and now really enjoying my time in practice actually, and enjoying you know, the freedom of sort of working independently, and being able to make decisions without having to consult a supervisor, and sort of trusting my judgment again. I have enjoyed getting back into that sort of swing of things, yeah.
But still, I presume, still getting a bit of support as you know the team that's there? There was your old ESs there.
Yeah.
So,
Support when I need it, I think. And it's a nice team of associates. We're all around the same age, around a similar stage in our career. And so it's really nice to have that peer support. And if we have, say, a challenging case or a case where we're not entirely set on a treatment plan, we want to sort of discuss the options and what we might do, then we can rely on one another to do that, which I'm really grateful for.
So you'd recommend going back to your FD practice if
I think
feasible?
I think it makes the transition a lot easier.
Yeah.
I think that I would feel pretty nervous about going to a new practice and having starting a new job, regardless of what the job is intimidating, and you have all of these people to meet. You have, your new boss to please, and then as a dentist on top of that, you've got your patients to deal with. And so I think I was lucky in that sense. Would definitely recommend if anyone else is considering the same early on in your career, having that support when you need it is vital, really.
That sounds good. So, Nikki, contrasting that, I know that you were offered a position back at your FD practice, but it was inconvenient to get to. Is that right? It was a bit far to travel.
Yeah.
So in a completely different situation. So here you were coming out of DCT, minimal practice experience, and you were suddenly having to find that job. I'd imagine that's quite daunting. I've not done it myself, but how on earth do you even start? How did you start that process of finding that practice job and then getting it and then doing well within it?
To be honest, because I had no idea. I don't know, like my other friends were all in Cardiff and it's very different in Cardiff. So, but I didn't even know where to start to begin with. It was, I was asking people, like, where do I even look for this job? So a lot of options were given, like BDJ jobs on the magazines and things. The way I found it was D4D on the Facebook page. I found that quite good actually, because there were loads of different, job adverts coming out all the time. And it was the only way to get on it was you had to be a dentist. So, it was obviously legit jobs coming through there. I know that there are other agencies that you could sign up to as well. I didn't really get around to do that. So still found it through D4D. And it was a bit daunting because, with DCT and everything till then, I knew what they were going to ask me at like interviews. I knew what the process was going to be. Yeah, it was very structured and felt like as a cohort or as a group of friends, we were going through it together. This time, my other friends were going through DCT2. I was kind of breaking away from the pack. It was very different. What I did to prepare for it essentially and to give myself like a bit of an introduction was obviously to make a CV first. And I'd not really made a CV before then. So it was a lot of researching. And I remember actually looking at another podcast actually on how to make a CV, another dental podcast. So I would advise, listeners to, do their research, on how to do it if you've not done it before like me. And then I got the consultants to also look at it at work, because they obviously would have done it before. And it was quite helpful, some tips they said. And then what I also did was I made a portfolio, and it was a clinical portfolio, and it was at the end of it had like achievements and other sections, like any good reviews I got from other practices, any like things I'd done extracurriculum, the projects and everything else. So I put all that with some clinical photos, made sure that it was, showed a variety of work to show the practice I was going to, what kind of stage I was, what I'd done before, and what I could really offer to the practice. And then, then I started sending them off and getting their replies back. So because it was still through COVID, I went through loads of different interview processes. Everyone was interviewing in a different way. Some were just online. Some would send back a series of questions that I had to fill out and then send back to them. And some wanted to see me face to face even to begin with. So it was really, really varied, I'd say. But it was a very different experience, and that's how I really approached it to begin with.
So I think, really important, I guess, is that element of preparing yourself. So doing your CV, doing your portfolio. I'm sure we've all looked at these dental pages. It seems like it's a common way to get jobs now. When you look on those pages, they all, to me, seem the same. It's the same post. We've got all the mod cons, we've got digital x-rays, we've got wave one or whatever. There's excellent private potential. Everywhere seems to have excellent private potential. How do you, when you look at those adverts, how do you have any idea which is any good, which is the one that would be good for you? How did you sift through all of those?
It's true. I would say to this day, I still don't know. They all say the same thing. And one way to narrow it down a little bit, first was for me through distance. And I would really, now that I've started the job as well, you know, it is a very high intensity job. Even when you get used to them, it is very, you know, physically demanding day in, day out. So I wouldn't go somewhere that has a very long distance to where you're living, because it will.
Are you close to work?
Yeah, I'm a 15-minute bike ride.
Number one tick to have made.
So I'd say that was my first filter, was how close it is. And secondly, I went on their website just to see, you know, have a little bit more of a look, see how they were doing, who was at the practice, whether they had, for example, FDs at the practice, because I thought, and you know, if they have FDs, they might be a bit more supportive. The age groups of the other associates, because obviously I'm quite young still in my career, so I thought it would be nice to, you know, have some other young associates there. So those were the things I was really looking at on their website as well. But still, even within that, it didn't narrow things down. So I actually applied to all of them. I applied to a lot. And I went to a lot of interviews, and I think that was actually really good. It's kind of like, I'd say, speed dating. Like, you get a good vibe about how the place is. And when you go to one interview, you think, oh, that was really good. And then you go to another place and you're like, oh, that was even better. It's like, it makes you think of things that you didn't think before, and it just widened your horizon. So I would say, you know, don't be afraid to apply to loads of places. Personally, I thought it was good for me. But then you have to end up, you know, narrowing those choices down and having a sit and thinking long and hard about it. But yeah, sorry, I don't have a clever magic way of sifting through those posts.
Fair enough. What about, so you mentioned FD practices. So had you had the opportunity to speak to other FDs on your scheme? That were people able to give you information about? Because you being in London still, I guess we all know that everyone in dentistry knows each other. Was there an element of that networking that helped out as well?
Yeah, definitely. I got in touch with other people I went through my scheme and asked whether the practices they were at, if they knew anywhere. And some of them did say some places, and I went there, but it was too far from where I was living. I went back to going back to my FD practice, the second one was the first one I applied for. But by that point, we'd moved to East London. So it wasn't, and that was West. So I couldn't really travel to there. It was quite far. But yeah, I'd actually recommend people to, you know, start there, because I'd say those practices, you know, they've already been looked at. They are an FD practice, you know. It's a good place to start looking, I'd say.
Okay. I think it's really interesting actually that both of you have kind of broken away from the hospital to a degree, but you haven't quite fully made the plunge. So what is there any particular reason that you haven't decided to go into practice full time? Why only part time at the moment? Are you just testing it out, or what's the story there?
I think for me, one of the things I love about dentistry is that we can have such a varied career, and it's not uncommon for people to work in multiple practices, in and out of the hospital, in teaching, in research, and there are all of these different avenues, and I always wanted to have a nice amount of variety in my career, and then, you know, I guess also as a process of narrowing down what I wanted to do career-wise as well, by experiencing things and you know, potentially ruling things out or keeping on with the things that I've been enjoying. And so the opportunity arose when I was getting towards the end of my post as a DCT at the Eastman. And so, yeah, I sent off my application hoping that hoping that I'd get it. I always fancied doing some teaching. I just didn't really think that I might get the opportunity at this stage of my career. Thought that it was something that I might eventually get to do when I was a bit old and wizened. But and so mostly because I wanted to have some variety. I think that maybe one of the mistakes that people make in dentistry, and one of the reasons that dentists become unhappy in their job, is that it can be quite an isolated career. Certainly in practice, if you work in a small practice, some dentists might work in a single surgery practice, and they're in that small room day in, day out for a really long time.
40 years potentially.
Yeah, and I remember someone saying when we were at dental school that sort of psychologically it's not that dissimilar to being in a prison cell. and I think that must have resonated with me, because I then thought, oh, you know what, that I don't really want that for myself. I don't think I want to work in a small practice, potentially 6 days a week for the rest of my life. I'd rather try and experience everything and see what works, see what I enjoy. And so that was my real motivation. And so far, I mean, it's only a few months in, but so far I'm enjoying it. I think that it's nice to have my week broken up. I think it makes time go a bit more quickly, and keeps you motivated, keeps me interested,
and keeps options open again, coming back to
and
having different options open.
Yeah, I'd say the same as Max, really. I love it that it just breaks up my week. I'm at the hospital Wednesdays and Fridays. So Wednesday's bang in the middle. It's great. I look forward to it. So for me, it's same as Max, really. The opportunity arose at the end, and I sent off my application hoping I'd get it. And so I don't do a lot of teaching within my job. It's mainly one afternoon that I supervise some DCTs, but I still mainly see sleep apnea patients within the hospital, and I really enjoy the fact that you go in and you're surrounded by loads of people every day, and I just find it quite nice to have that interaction with them, the hospital environment. And I thought it would be good to, keep a foot in hospital. You never know what the future holds. If you want to go back, you can have that access to do like those clinical governance, those projects that, you need to get back into things, and to still have the access to like being able to speak to the consultants if you've got a difficult case, to have that all available to you, and then to still have the practice option as well if you want to fully continue into practice. So I'd highly recommend it to anyone, really.
That's good. I think probably another thing that people are concerned about when we talk about this transition from hospital to practice is money. I mean, it's something that we need to talk about. I guess there's two elements, really. One element is probably get paid more yourself in practice than you might do in hospital. But I think more importantly, in terms of concerns, is that conversation in hospital and in FD, really, to a degree. There's not a huge amount of discussion about costs. Was that a concern? Did you find that challenging to start talking more about money again after being in hospital? How did you find that element?
You're right, actually, and it's something that I think we both failed to mention. That definitely not something that you mention as a DCT, and not something that you're used to talking about. You talk about the treatment and the proposed treatment plan, and the potential options that the patient has there. But then once they've decided on what they want, money isn't a factor. And so it was something that I found a bit of a challenge, and something that I had come I'd say become unaccustomed to. But even as a foundation dentist, you treat most of the NHS patients, and most of the sort of treatment options that you discuss with them, you don't really stray that far from what the NHS has to offer. And so I think then starting to offer private treatments and discussing costs then is something that I think will probably take quite a long time before I kind of figure out exactly the best way to approach it. I think that I definitely don't feel overly confident yet in terms of that. And so don't know if Nikki feels the same or she's completely fine.
No, I'd say the same really. When I first started, obviously the fact of discussing money with them. In fact, I found out that band 1, 2 and 3, the cost had changed since I was in FD, so I had to put them on a post-it note quickly to tell the patients the right amount. So it was a lot of change, and I think definitely bringing up private treatment and offering them the different options was a bit daunting to begin with. Still to this day, I let them really bring it up if they're interested in other private treatments, that isn't part of their treatment plan, like aesthetic wise and so on. So I'm more led by the patient, because I feel like that opens up the conversation easier for me to discuss with them. But it is a definite aspect that you need to wrap your head around. But I'd say actually another side of money is, as an associate, is discussing the money with your principal dentist as well, because within the hospital, we just got a paycheck at the end of it. We didn't discuss it. Now with COVID and everything, I don't even want to delve into it, because I still don't understand it fully, but there's so many different things, the UDA value, everything that you got to discuss with them. So I'd say as an associate, there's a whole other side of things, and tax and so on, that we weren't really taught that well at DCT or DFT. So I think financially in both ways, it's been a learning curve, definitely.
Okay. If there was somebody who's doing DCT at the moment who was thinking about going back into practice, is there any advice that you would give, having just gone through this experience? Any tips, tricks, anything that you think would help them?
I'd say that it's always going to be a little bit of a shock moving from the DCT pathway back into practice, as for all of the reasons that we've discussed. I think if you manage to find a practice where you have an understanding and a supportive principal, and you can hopefully sort of have a transition into practice, I guess. I think when I reflected back on my first few days back into practice, I was very much, I think because I'd been there as a foundation dentist and I was familiar with the place and familiar with everyone, I was very much thrown straight in to a full diary, no warm up, just straight in. And I think on reflection, it would have been nice to perhaps just spend some days shadowing the other associates, perhaps start off with a quieter book just to get used to using the computer system again, and just get used to the whole, the everything that working in practice entails. And so if I could rewind time, I would probably have had that conversation with the principal beforehand and said, I would quite like this. I don't think it would have needed to be very long. I think maybe just a couple of days even, just to get back into the swing of how it works, and the dealing with all of the things that you have to deal with.
Yeah, definitely. Following on from that, I found that I did shadow just because I think I was in my FD practice, so I didn't know everyone there. So I chose to go in and shadow. I think I went 2 or 3 days, and I found that really useful when I started it. I didn't actually think it was useful when I first went to shadow. I thought, it's fine. But when I actually started it, the fact that I knew the computer system and I got to know the team a little bit better, it actually helped a lot with regards to managing everything.
And you shadowed the list you were taking over, was that right?
Yeah. So I shadowed so essentially it was someone who was leaving the practice after 14 years. So I shadowed him with how he was interacting with his patients and who he was seeing. And he actually pointed out some of the patients that were going to come and the treatment that was outstanding and needed to be done. So it was good. I kind of felt more prepared of what's going to come, and I got the heads up about the patients and so on. And just to get to know the team, I hadn't used that computer system particularly well. So that was good. So definitely, totally agree with you, Max. It's good to go in and shadow.
Ease into it. I think that's really good advice.
Yeah.
So what's next for you guys? Is it going to be staying in practice? Are you going to keep this split hospital practice setup? What are your next steps, do you think?
I mean, you may have gathered already, I'm not someone who has a real set career path within dentistry. I quite like my fingers in lots of pies first. And I think I'll just carry on with my current setup. I'm enjoying it as it is. It's only been a couple of months.
Yeah.
I'm very much looking forward to building on my teaching experience with the hygiene and therapy department. We've just started supervising them, seeing the first patients, and so been very good reliving that whole experience and experiencing what it's like from the other side, but from having been through sort of 7 years as a trainee of being supervised. To be the supervisor is quite, it's quite eye-opening, really. That certainly sort of made me understand a lot more about how difficult the job is for the supervisor, and so yeah, building on that experience and building on my experience in practice, getting completely used to it and seeing where it takes me, maybe undergoing some further training in a certain area in the future, but as yet not sure which that would be.
Fair enough.
So with me, I kind of knew from early on that I wanted to do postgraduate training, like within DCT level, and I was quite interested in pros. So I'm going to try and apply this year or next for the prosthodontics and Dent. And really having fully come to that conclusion led me to reevaluate my practice. And I found out that the practice I was at currently, the patient base wasn't the right patient base for me to practice the skills that I would be learning in this prosthodontic course part-time. So that led me to the decision to look at different practices, having started this practice 2 months ago. And so yeah, long story short, I've given my notice in yesterday, and I'm going to move to a new practice in 3 months. So yeah, big change.
A lot of change, yeah.
A lot of change again. But I think it's been good. I've gained a lot from my short experience there, and I've learned a lot of what things I like in a practice and what things I didn't like. And having applied again, it was more useful because I knew what to expect and what things to look for. So yeah, within the new one, I think it aligned with my career goals, but better, and allowed me to learn the skills within the pros and apply them. So yeah,
I think that's another good piece of advice, is to do what's good for you, I guess, and if you have a pathway or something that you've got in mind, then just to follow that and do that, whether that's practice, DCT, whatever.
Yeah, definitely.
So to finish off, I would like to hear, so if there's DCTs out there thinking about going into practice and they're unsure, sell it to them. What 3 things do you think are good about practice that you enjoy about your job?
I love how busy it is and how you're like on all the time, and you see a wide variety of people day in, day out, and I love making that social connection with every single one of them, and getting that relationship with every single one, seeing them come back, finishing treatment plans. It's a very different to hospital. You got a lot more independence, things get done a lot quicker, which is good. And I really enjoy getting faster clinically, getting more competent, more confident in my own clinical judgment and self. And I'd say, well, I didn't have this within hospital where I didn't have the same nurse. So now I've got a nurse that I work with regularly, and I really enjoy the connection we've built, and we just work around each other. Like, she knows exactly what I want when. Just makes the whole thing a lot more streamlined. Yeah. And I actually really look forward to going to work, seeing her and seeing the patients together. So those are things I love about practice.
That's nice. I think Nikki's probably stolen a lot of the good points there, Max. Have you got any additional?
I think she might have done, really. I completely agree. I think that the whole process in practice tends to be a lot more efficient. I'd say also, compared with being a DCT, you have much less paperwork, and so
I can
when
that.
When the practice closes, just after 5, I can cycle home, and I'm work doesn't come home with me. I haven't got a load of letters to write and things like that, and so I'd say that in terms of my personal life, I've benefited from that. being able to come home and, you know, just make dinner or go out running, whatever, without having run late and then have a load of things piling up to catch up on. And so I think that's really nice. And again, the continuity of, you know, rather than being in a post for 1 year, seeing people for a certain treatment and then not seeing them again, and not having that follow up and seeing your failures really, and learning from those. I think that's, you know, a really important learning element of our career, really. Learn, you know, far more from your mistakes than your successes. And so maybe Nikki, being in her practice for a few months, might not see too many mistakes come back, hopefully. But yeah, I think that being able to see your patients from start to finish, recall them, I think that's a nice element as well.
Perfect. That's great. Well, thank you both so much for your time. It's been really interesting listening to both of your experiences, and I'm sure our listeners have found that really useful. So thank you very much.
Thank you.
We hope you've enjoyed listening to this episode. We would love to hear your suggestions for future guests. Remember to follow us on social media using hashtag the Eastman Dental Podcast. And if you like what you hear, please like, share, subscribe, and listen out for future episodes.